Thanks for joining us. As COVID-19 continues to spread across Wisconsin, we found out some people wait a week or more to get the call that they've been exposed. Some never get the call at all. But how often is that call coming from the state? Naomi Coles found out how often they're stepping in to manage the surge in contact tracing. Naomi?
Eric, we're learning that the state conducted thousands of calls in the last month for overwhelmed county health departments. But even that wasn't enough.
In Wisconsin, we know right now we're in a crisis.
Between September 6th and October 5th, contact tracers at the DHS interviewed more than 7,000 people, supporting health departments in 57 counties. And while Rock and Jefferson were on that list, it hasn't been enough to handle the surge.
We were asking for state help in the beginning, and then when we found out that they were running 5 to 7 days behind, we made the decision to stop.
For perspective, in Rock County, a team of 21 people is trying to keep up with around 800 calls a week, according to a rough estimate from a spokesperson.
And with our additional staff that we've hired and help from the state contact tracing team, we're still not able to contact people as quickly as we'd like to.
In 3 out of the last 5 days, they've had more than 100 new cases to track.
Can it take up to a week sometimes to reach out to all the contacts for a particularly high contact case?
Possibly, yes.
Overwhelmed counties are triaging calls by order of priority, placing those at risk, the elderly, and schools first. In Jefferson County, many contacts of a positive case won't ever get a call. The calls telling people they're positive are taking long enough.
That case interview can take a few hours. If we're calling their contacts, then that can take 3 to 4 to 5 hours as well.
And while less contact tracing is risky, the reasons behind the surge are simple.
We found that a lot of these positive infections are resulting from really a lack of adherence to those public health guidelines.
There's a clear message here, and it's the same one you've been hearing all year. Stay home if you can. Limit your contacts. Wear your mask. Stay distant from others. And an added precaution right now, get your flu shot.